since the Speaker of the House, Nancy Pelosi, on CNN last night was more interested in calling President Trump morbidly obese than telling you the facts about COVID-19, I will. Here are 10 facts about COVID-19 and the government-mandated lockdowns. Number 1, children are more likely to die from the flu than from COVID-19. This, according to CDC data and international data analyzed by Dr. Scott Atlas from Stanford. Number 2, if you are under the age of 24, you are more likely to be struck by lightning than to die from COVID-19. This data, according to Ovik Roy at the Foundation for Research on Equal Opportunity. Number 3, more than half of COVID-19 deaths in 20 states in the United States are in nursing homes, including 81% in Minnesota, 72% in New Hampshire, 75% in Rhode Island, and 60% in Washington State, Oregon, Nebraska, North Carolina, Virginia, West Virginia, Pennsylvania, Massachusetts, and Delaware. And yet, our politicians are ignoring it. Number 4, a new study from NYU doctors shows hydroxychloroquine with azithromycin, which is an antibiotic, and zinc reduced the risk of death in COVID-19 patients by nearly 50%. Number 5, when Colorado revised their COVID-19 death toll this week to differentiate between people who died with COVID versus people who died from COVID, their COVID-19 death toll dropped by 25%. This, according to the governor of Colorado, Jared Polis. Number 6, new studies show herd immunity might be reached for COVID-19 when between 10 and 43% of the population contract the virus, versus the traditional 60% required for herd immunity, which means some cities and states and even entire countries might be getting close to herd immunity. Number 7, lockdowns themselves are deadly. People commit suicide at higher rates thanks to unemployment, according to the National Bureau of Economic Research. People are denied surgeries and medical treatment, which could cause more people to die from cancer than from COVID-19, according to a British doctor. And the economic devastation from the lockdowns causes poverty worldwide that could lead to the death of hundreds of thousands of children, according to the United Nations. Number 8, in Sweden, in Georgia, in Florida, where lockdowns are lifted, or there were never lockdowns to begin with, there has been no massive outbreak of COVID-19 infections. Number 9, the highest risk of COVID-19 transmission is at home, among family members, according to studies from Hong Kong, Germany, Taiwan. And the risk of transmitting the virus outdoors is 18 times less than transmission indoors, according to a study from Japan. Number 10, the prediction models, like Neil Ferguson's Imperial College London model that predicted 2.5 million COVID deaths in the U.S., were wrong. They were always wrong. They've been proved wrong. Even Ferguson himself admitted he was wrong without saying he was wrong. But politicians who base their COVID-19 lockdown policies on those models refuse to revise their policies based on all the science I just presented to you.